Nigeria has recorded 117 new cases of the coronavirus, the highest single-day figure since the outbreak of the virus in the country. This now brings the number of cases now to 782. 197 patients have been discharged, while the country has recorded 25 deaths. Of the 117 new cases, 59 are in Lagos, 29 in Abuja, 12 in Kano, 6 in Borno, 4 in Katsina, 3 in Ogun, and 1 each in Rivers and Bauchi states. In all, Lagos has recorded 430 cases of coronavirus. Abuja 118, Kano has 773 cases. Osun and Ogun states have recorded 20 cases each. Oyo and Katsina states have 16 cases each. Edo State 15 cases, and Kwara, Kaduna, Akwa Ibom, Borno have 9 cases each, while Bauchi State has 8. Gombe has 5. Delta and Ekiti states have recorded 4 cases each. Ondo and River states have 3 cases each, while Jigawa, Enugu, Niger, and Abia states have 2 cases each. Benue, Anambra, and Sokoto state have 1 case each. As cases of coronavirus continue to rise in Africa, the World Health Organization is emphasizing on the need for people to stay at home and maintain social distancing when out. Now, this is as communal spread of the virus is now on the increase. Joining me now via Skype from Burkina Faso to discuss this is Director General, West Africa Health Organization, Professor Stanley Okoro. Now, Professor Okoro, it's nice to have you join us now. Now, the warning from WHO has been on for a while when it comes to the fears that the numbers could rise because of the state of health in sub-Saharan African countries. Now, many of the countries are on lockdown, like Nigeria, many of the states are on lockdown, but we still see the numbers rising. What could be responsible for this?
Thank you very much for having me. Yes, of course, the countries are on lockdown, but lockdown is a measure that helps you do something else. And the second thing that the measure helps you, or the things that it helps us to do, is to be able to test people, to be able to trace people, and to be able to treat people. And therefore, the lockdown by itself, without the other measures, is not going to stop the virus. And one of the things that you may find is that as our countries ramp up their testing, you will find that the number of cases will go up. So in Africa today, we have about 25,000. In our region of West Africa, we have about 5,000 plus. And Nigeria is about the third in our region. Ghana, which has actually started doing a lot of testing of people, have realized that as they test more and more people, they're finding more and more people. Ghana has about 1,047 cases. And not only that, what we are seeing is that there is a significant number of people who do not have symptoms, but who have the virus. And so the more you test, the more you find. To date, Ghana has tested about 69,000 or more cases. Nigeria has tested about 8,000 and they're ramping up. So as at today, we have about 11 to 14 laboratories in Nigeria. I'm sure NCDC will be able to give you the exact figure. When we started this, there were only 2, and then it moved on. So there are all these developments that are happening to ensure that we rapidly get out of this situation. So please, the plea through you to the population, it's not that a lockdown simply will do it for 2 weeks or 3 weeks. No. During the lockdown, there are people working actively 24/7 to try and trace people, to test more and make sure that we contain this pandemic.
Precaution to contain this. What is most important to be done right now by these countries, especially like a country like Nigeria?
I think what will be done is really what the NCDC is planning, Nigeria Center for Disease Control. And also the multi-sectoral committee, the presidential task force, that's a fantastic initiative. And it's really important because it brings all the, if you like, power behind the public health measures. And that then means that whatever we need to do, you have the facility, you have the support, and you have the acceleration of those. So what do we need to do? Test, test, test. Trace people. And Nigeria is already making the plans. They have a phase 1, phase 2, phase 3, and I think phase 4 of the plans that they have. The information we are receiving makes us confident that Nigeria is getting on top of the curve. I understand that as they are rolling out in the next few weeks, that they are going to start using other platforms to test. And you know, I'm sure your viewers may have heard, across the countries, we have been discussing globally, can we use, particularly in Africa, where we may not have access to very expensive coronavirus test kits, can we use the test kits we were previously using for TB, or we are currently using for TB, which is very widespread, including tests that we are, not test kits, but test platforms that we are using for TB, including the ones for some HIV, the platforms, because all these are molecular testing. And therefore, if you get the right reagents, then you can use the same platform. And that is one of the things that I understand from discussions with Nigeria Center for Disease Control. They are thinking of doing that. And we hope that once there are massive testing across all the states, you will find that the cases will rise. So the cases rising should not be worrying to people. Actually, the more cases we find, the faster we can get to contain this pandemic, because it then means that those people will be stopped from infecting others, and then we're able to stop this pandemic quicker. Remember, it's having economic implications at the same time in terms of the lockdown.